the next panel is going to be talking about culturally competent healthcare, and there have been some questions that have been submitted already about that as well. We have a varied set of speakers here, folks, clinical folks, folks working on advocacy in this realm, folks doing training on competent healthcare. I'd like to start out from a local perspective. Dr. Hingston, hello. LGBTQ cultural competency in healthcare could mean a lot of things. So let's start out with you introducing us to the concept, what it means when we talk about LGBTQ healthcare competency, and specifically what it means for older folks in our community.
Okay. I think the culturally competent healthcare for our community really needs to remember that many of us have years and years, and some of us decades of mistrust, stigma, discrimination within the healthcare system. And even though today it's much better, there are still big issues that remain, especially for our transgender and gender diverse communities, non-binary people. I actually recently had a dear friend of mine who is transgender have a horrible experience at a local healthcare facility. And I think oftentimes, especially in Palm Springs, we feel like we live in this bubble of safety and everybody's LGBTQ, and we have a lot of resources, and yet this happened here in our community, and it was quite shocking. I think competent health care, like Lisa said at the beginning of this, is about dignity, and it's about respect. It also means that we are more likely to go to the doctor, to do follow-up visits, to see a therapist when we feel like that person sees us for who we are. We need to feel okay to talk about our sexual lives. I know personally for me, going to the gynecologist for decades, and every single time I go, are you sexually active? Yes. Do you use birth control? No. And then you get that look. And especially as a young lesbian, that made me not ever want to go, because I didn't want to deal with that every single time I had to go to the gynecologist. And if providers don't know the right questions to ask, then people in our community are way less likely to go and take care of their health. And then not only LGBTQ people, but then you add racial, ethnic, cultural minorities. So people of color going to healthcare facilities where typically it's a white, middle, upper class, heterosexual focus base. I mean, even as much as when you walk into an office, the art on the wall, the pamphlets they have, the magazines they have in the lobby for you to read, all of that is so important, and people notice that. We notice that when there's nothing that looks like us or nothing that pertains to us. Also, as far as healthcare providers go, just to understand that certain communities, racial, ethnic, minorities have specific issues, and they may view healthcare, especially mental health, very differently from white people, and so they attach different just different ideas to certain symptoms, and that, we don't, I know for me, I hear a lot from transgender people, I'm so tired of having to educate my therapist. I'm so tired of having to educate my doctor. So part of being culturally competent is, at least if you don't know, that you're willing to ask the questions and know the right questions to ask.
Great, thank you so much for that introduction to the topic, Dr. Hingston. Patty, I'm going to turn it over to you. Actually, you lined up perfectly. Thank you. Because Patty, My question for you is, you work for Watermark Retirement Communities, which is a multi-state senior services company that's really been on the forefront of trailblazing initiatives to move forward LGBTQ competent care. As a private company, it's really remarkable. Can you tell us a little bit more about those efforts, why they were so important to Watermark, and as an example to other companies that are doing this work in senior services?
Sure, and thank you for having us here today. Really appreciate being here today. As Hillary stated, we are a Watermark Retirement Communities, and we have 60 communities across the country in about 25 states currently, and one of them right here in Palm Springs, as a matter of fact. Several years ago, we recognized that, yes, we are training our clinical teams and our staff across the country in, in a diverse approach to healthcare, but we recognized that there was one piece that was vitally missing in our training, and that is the piece of the LGBT. And so we reached out to SAGE, and we began to partner with them in putting together a training program that we could take across the country. And we are in the process of doing that. We have 60 communities, and we are about 50% complete now with training our associates, our management team first. We go to our management teams. SAGE trained 8 of us, to train our own staff. I'm one of those trainers. And we take it to the community. We go on a road show and we do our training about about inclusiveness in caring for our seniors. We recognize that we're an organization that cares for seniors, and we were missing a really important and vital piece to caring for all seniors. Right, and so we've taken on that challenge to do that. After we train our management staff, we worked with SAGE to create a training for our 6,000 associates across the country as well. So we have an in-house online training program that every associate is required to complete. And so that is in process right now. So it's an ongoing, there's turnover of staff, right? There's turnover of management teams. So some of our communities that we have already trained, we've gone back again and completed the training again. I think you asked also, why is this important to us? Again, we're in the business of caring for seniors, and we don't pick and choose who those seniors are that come into our community. It is everyone's right to be cared for equally.
Thank you, Patty. It's so inspiring and exciting. So, Riku, I have a question for you. Following from Patty's remarks, actually, as a person working with companies such as Watermark in training their staff on LGBT aging concerns, and as a person who's training with SAGE as a SAGE care trainer, can you tell us a little bit more from your perspective on working with service providers themselves? How are folks taking the training? How are they learning? Tell me.
Cool. Yes, we'll do. Good morning, everybody. It's still morning. How's everybody doing? Just curious. Because it feels like there's so much learning. So it's intense. So just curious how folks are doing. If you need to stretch, please feel free to stretch. But yeah, just curious how many folks are service providers in the room. Cool, yay. So if you haven't been trained up by SAGE Care, please do talk with us. It's been a pleasure. Actually, Jill and I attended the same Train the Trainers in Chicago. So that was cool in 2017. So I've been a trainer since then, and it's been phenomenal. It's been a really great experience to do outside of my day job, which is I work for the County of Los Angeles. I used to work for the Commission on Human Relations, doing trainings on a diverse range of topics around equity and inclusion, kind of focused on sexuality and gender. So this has been a cool crossover to then work with the aging branch as the LGBTQ information and assistance liaison. Recently, you may know that the state of California mandated, California Department of Aging mandated all of the area agency on aging folks and service providers to collect sexual orientation and gender identity data voluntarily. So you may now volunteer, and you will be asked, as mandated by the state, your sexual orientation and gender identity when you're accessing services. How many service providers have already received such a training? Yay! So the law passed a couple years ago, so for those who are not yet there, that's okay, we can get you there. Sage Care has an online training, and we can also do some in-person work, but that's kind of what I wanted to talk about, is comparing the time that when I first got trained up and attended my first training. It was continuation of the Sage Care certification. So it was like an hour-long sort of review. Everybody was super informed and eager, had awesome questions that were very nuanced, and like, I was so excited. I was like, experts, this is so easy. This is like I love this. I want to work here full-time. And then in a short amount of time, another training I facilitated was, I think as a result of some complaints from community. It was, I think, the trans-specific training, and that was different. It was a different organization in terms of their focus wasn't like trans community. It was a housing organization, and it was a larger group as well, and it was only an hour. So I think I was challenged as a facilitator. So this work has encouraged me to sharpen my skills, how to include a lot of information in a short period of time and get people what they need. So I'm the kind of trainer that's like, oh, go ahead and interrupt me, please, please, please. I need to know what you need to know, because I only have like this much time, and the slides are awesome, but I'm 42. Let me see. So I am of the PowerPoint generation, but also love pen and paper, love the flip chart. So I am a much more interactive trainer. I want to hear what you want to know. I think I said that already. So it's been super rewarding to hear people tell stories about their personal experiences with family, friends, loved ones. And it's also been quite profound to hear people talk about clients in a way that they recognize in the moment that they are underserving people, that people are not receiving what they need. And then connecting that to people's own experiences of inequity and discrimination is powerful, super powerful. Whether that's about gender, sexuality, race, ethnicity, national origin, age, all those ways. There's so many ways that we can connect. So yeah, I'm trans also. I don't think I said that. My pronouns are he, him, so I'm very out in life. And I'm also queer identified, so both of those things I say sort of in the beginning of these trainings, so it's also it's very vulnerable. You get very vulnerable very fast. Oh, I do. And that's, again, rewarding and also difficult to recharge from, I think, so I'm glad that I don't do this full time. I honor your work so much because it seems very difficult to hear people talk about experiences of isolation and discrimination within the workplace, who are also serving clients who are also isolated and discriminated against. So what I mean by that is LGBTQ staff who will come out in the training or sort of come out, and I think that those moments to me are so difficult. So my favorite trainings have been those organizations where you can tell people feel comfortable to be out, and so too are the community members, the clients, everybody feels good, and you can really feel the difference just energy-wise. I'm sure you all know the difference. So yeah, check.
Thank you, Rico. And actually, before we move on to Robbie, who's going to talk on a slightly different note about advocacy, I want to stay on training here because a couple of questions have come up. Patty, one that I handed over to you, I think is a really interesting question that the person noted it's one thing to train the staff, and then it's a whole other body of stuff when you are dealing with the other residents. So from your perspective as a clinician, tell us a little bit more about your experiences there.
It's a great question. The question, as Hillary says you can train your staff, but what can be done to make the setting, including residents, more LGBT inclusive and accepting? And that's one of the very first questions that we encountered as we began our training. Okay, great, we can do all of these great things with our associates and our staff, but what about the other what about the residents? How do we reach them and educate them about what it is we're doing? So the first thing that after we did a couple of trainings, we recognized, okay, we need to be a little bit more transparent about what we're training our associates on. Make sure that it's out there, that we're training our associates this is an initiative, this is something that we're taking a stand on, and that we believe in, and that we're going to support throughout the country. And so that was the first thing that we did, is okay, we can't do this behind closed doors and training our staff. It has to be out there and open. The next thing is, you talked a lot about different programs, and the organization that you work for here in Palm Springs that has all different kinds of programs. We're doing the same thing in our communities. We have what we call our Watermark University programs, and we do very specific trainings and teachings and education in our programs for our residents that include LGBTQ. And so that's one way of reaching our residents, our other residents who may not be as well informed as they should be. Thank you, great question.
Yeah, terrific question. And then one other question pertaining to the training is somebody asked, do we feel that the Sage Care webinars are as effective as in-person training? Another really strong question, and one that we struggle with. We do evaluate both, and actually have found that with the same amount of time, people are learning online at the same effectiveness level as they are in person. The difference with in-person, though, is that we often have more time to spend in interaction, as Riku talked about, answering people's questions and really getting to the heart of where people are at. And so to the extent that there's more time to do training, in person does have some more effect. But of course, we can't train every person in person, so there has to be a balance. And Patty described that taking the approach of the management first with in-person training and then the associates online is something that we're trying to find that balance of effectiveness. So Robbie, let's switch gears slightly. Robbie Rodriguez is here from Equality California. Moving away from direct services and into the legislative front, and as we think about culturally competent healthcare, Equality California has done a ton of legislative advocacy work in California. We can all be very grateful for your work. I want to talk specifically about your work on culturally competent healthcare and HIV. Can you tell us more about the work that you all are doing on that front?
Yes, hello everybody. As Hillary mentioned, I'm Robbie Rodriguez. My pronouns are he, him, his. I've been with the organization for 4 years, and in those 4 years, I'm the program director, so I oversee all of our programmatic efforts for the organization up and down the state. To date, Equality California has sponsored over 140 pieces of pro-LGBT legislation, so I'm going to talk about 3 bills specifically today. And I'm going to read because they're laws and I don't want to misread anything, misstate anything. So the first one is just happened this year. It's SB 159. This was the PrEP and PEP access expansion. This was sponsored by Senator Wiener, or authored by Senator Wiener and Assemblymember Todd Gloria. SB 159 will reduce barriers to accessing HIV preventative medications. This legislation will authorize pharmacists to furnish PrEP and post-exposure prophylaxis PEP to patients without a prescription. Pharmacists are already authorized to furnish birth control pills or flu shots without a prescription, so this is kind of in line line with that. The legislation will also prohibit insurance companies from requiring patients to obtain prior authorization before using their insurance benefits to obtain PrEP or PEP. And this was signed into law by Governor Newsom on October 7th of this year. A major advantage to having pharmacists involved in prescribing PrEP is that pharmacists are easily accessible and are located in almost all communities across the state. Pharmacies can also be more approachable for people that are less inclined to go to a clinic. The ability of pharmacists to administer flu vaccinations is a prime example of the positive effect when states expanded pharmacist roles providing preventative medications. For example, the odds that an adult would receive a flu shot increased by 7.8% in states that allowed pharmacists to immune patients. In order to provide more easily accessible healthcare services, we must better utilize community pharmacists. So that's one piece of legislation. In 2017, we had another piece of HIV legislation that many folks might not know about. SB 239, which was modernizing discriminatory HIV criminalization laws. This was also by Senator Wiener and Assemblymember Todd Gloria. So SB 239 modernized California laws criminalizing and stigmatizing people living with HIV to reflect current understanding of HIV prevention and treatment. It eliminates HIV-specific criminal laws that impose harsh and draconian penalties, including for activities that pose no risk of transmitting HIV. The bill is supported by public health officials because laws that criminalize HIV discourage people from getting tested and from seeking treatment, which impedes public health objectives of eliminating transmission of HIV. SB 239 would make HIV subject to laws that apply to other serious communicable diseases, removing discrimination and stigma for people living with HIV and furthering public health. And this was signed by Governor Brown. And then lastly, I wanted to do a plug for SB 219, which was the Seniors Long-Term Bill of Rights. So SB 219, authored by Senator Scott Wiener, strengthened protections for LGBT seniors living in long-term care facilities against discrimination. So examples like refusing to use preferred name or their proper pronouns, denying admission to long-term care facilities, transferring a resident within a facility to another facility based on anti-LGBT attitudes of other residents, or evicting or involuntarily discharging a resident from a facility on the basis of their actual or perceived sexual orientation, gender identity, gender expression, or HIV status. And thankfully, this was signed by Governor Brown. That's it.
Great, thank you, Robbie. A lot happening, and as we know, laws on books and laws in practice take some time, which is why we're so appreciative of the folks who are trying to make these laws, the service providers, to make them living documents as we experience them. I want to go back to, I realized that there was a question that came in earlier around integrating LGBTQ services into, the question was related to all senior centers, and I think it's applicable here on this panel. The idea that we have and that you hear some of these panels talking about around training, quote unquote, mainstream service providers is really critical and something that SAGE takes very seriously. Groups like SAGE, other service providers that are working specifically with LGBTQ seniors can't serve everyone, right? We have an amazing affiliate in the desert here, but we have 30 affiliates across the country. It's a drop in the bucket. Where we really are trying to have an impact in every community in this country is by getting LGBTQ information out to providers who are working with seniors, whatever in whatever circumstance, in whatever community. So that's a senior center in the valley here, right? It's an assisted living up in the Central Valley, right? We're trying to to get to providers wherever they are, because LGBTQ seniors, as we know, live all over the place, all over the country. And so to that end, here in Palm Springs, the Mizell Senior Center, not an LGBTQ specific senior center, does an incredible job of working with the LGBTQ community. In fact, I had a conversation with their executive director, Wes Winter, a couple of weeks ago, where he estimated that about 50% of the people they serve are LGBTQ. So while it's not specifically LGBTQ, the important thing is that we're trying to reach providers everywhere about these critical issues. So we have time for I think 2 more questions. Thanks. And so, Patty, I have another follow-up question for you. Can you tell us a little bit about your continuing care retirement services, right? So tell us a little bit more about your experience around how folks are taking this training who are working with memory care services.
So the folks who are getting the training, one of the things that are, their training is no different than anyone else, other than we have come to recognize that we may have many seniors who have a cognitive impairment, who are in our memory care communities, who may not have come out to their family or to their friends. And so now, as they've aged and with this cognitive impairment, they are. And so now there's this education of how do we now communicate what is happening to the family who may be totally unaware of what their loved one has been through their whole life and who they are. And so there's lots of very interesting questions that have come up across the country of how do we manage this? How do we deal with this? And it's on a case-by-case basis, based on the families, whether it's their biological family or those that they identify with as their family. So it has become a conversation, a very open conversation with us across the country too, in how to care for our seniors with cognitive impairment who may or may not have come out. So that's an interesting piece too.
Really important and complex. Our last question, Robbie, this is for you, and I think that we're going to have a policy panel later as well, but I think that as a representative of Equality California here, this would be a great one for you to just touch on. What are the top 2 or 3 active bills that are moving right now that folks here in the community can lobby their representatives to vote for?
So we're in between cycles right now, so there really isn't anything to my knowledge, but there are probably some issues that people should be aware of. The first is that 2020 is going to be a very big year for all Californians in the country. Not only do we have a big election coming up, but we do have the census. So the LGBT population is considered a hard-to-count community for a variety of reasons. Historically, for one, we're not actually included in the census metric, but we do know that LGBT people are part of every community that is also considered hard to count. We're people of color, we're in transitional housing, we're low income, et cetera, down the line. So we do want to urge that the intent of the current administration to undercount California is a real threat, and so we want to make sure that everybody participates in the census and that you promote the census to all of your friends and neighbors and family, because California does have a lot at stake, and we do, so many of our community rely on the public aid programs that the census helps fund, so we want to make sure that we do participate. That didn't exactly answer your question, but I did want to make sure I plugged the census.
Really important, and folks will hear a lot more about some federal work as well as some local legislation when Michael and Councilmember Middleton return to the stage. So thank you all very much. Let's thank our panelists here. And we'll transition to the next panel where we'll be talking about housing, which has, there are a number of questions that have come in about housing specifically, so I know the folks are eager to hear from the next panel.